Inflammation is a natural and essential part of the body's immune response. It is a process by which the body's white blood cells and the substances they produce protect us from infection with foreign organisms, such as bacteria and viruses. However, when inflammation persists or becomes chronic, it can turn from a protective mechanism to a source of health problems. This article delves into how inflammation, particularly chronic inflammation, can be at the root of a multitude of health issues. We will explore the causes, symptoms, and potential treatments for inflammation, as well as its connections to various chronic diseases. Understanding inflammation. Acute versus chronic inflammation. Acute inflammation is the body's immediate response to injury or infection. It is characterized by redness, heat, swelling, pain, and loss of function at the affected site. This type of inflammation is usually short-lived and resolves once the underlying cause is addressed. Chronic inflammation, on the other hand, is a prolonged and often silent form of inflammation that can last for months or years. It occurs when the body's immune response fails to shut off, leading to continuous low-level inflammation that can damage healthy tissues. Causes of chronic inflammation. Several factors can contribute to chronic inflammation, including infections. Persistent infections by viruses, bacteria, fungi, or parasites. Environmental factors. Long-term exposure to irritants such as pollution or industrial chemicals. Lifestyle factors. Poor diet, lack of exercise, smoking, and excessive alcohol consumption. Autoimmune disorders. Conditions where the immune system mistakenly attacks healthy tissue, such as rheumatoid arthritis or lupus. Obesity. Excessive fat tissue, especially around the abdomen, produces inflammatory cytokines that contribute to chronic inflammation. Stress. Chronic psychological stress can trigger and exacerbate inflammatory responses. The health impacts of chronic inflammation. Chronic inflammation has been linked to a wide range of health issues, many of which are serious and life-threatening. Here's a closer look at some of the most significant conditions associated with chronic inflammation. Cardiovascular disease. Inflammation plays a critical role in the development of atherosclerosis, where plaque builds up in the arteries, leading to heart disease and stroke. Inflammatory cytokines can damage the inner lining of arteries, making them more susceptible to plaque formation. Diabetes. Chronic inflammation is closely associated with insulin resistance, a precursor to type 2 diabetes. Adipose tissue, body fat, releases pro-inflammatory cytokines, which interfere with insulin signaling, leading to elevated blood glucose levels. Cancer. Inflammation can promote the proliferation and survival of malignant cells, facilitate angiogenesis, the formation of new blood vessels that supply the tumor, and help cancer cells metastasize. Chronic inflammatory conditions like inflammatory bowel disease, IBD, are known to increase the risk of certain cancers. Neurodegenerative diseases. Inflammatory processes are implicated in neurodegenerative diseases, like Alzheimer's and Parkinson's. Chronic inflammation in the brain, often due to a buildup of amyloid plaques, can damage neurons and contribute to cognitive decline. Arthritis. Rheumatoid arthritis is a classic example of an autoimmune disease, where chronic inflammation causes painful joint swelling and damage. Osteoarthritis, although primarily a degenerative joint disease, also involves inflammatory processes. Digestive disorders. Chronic inflammation in the digestive tract can lead to conditions like IBD, which includes Crohn's disease and ulcerative colitis. These conditions are characterized by persistent inflammation that damages the gastrointestinal tract lining. Respiratory diseases. Chronic inflammation in the airways is a hallmark of asthma and chronic obstructive pulmonary disease, COPD. These conditions cause breathing difficulties and are often exacerbated by environmental factors like pollution and smoking. Symptoms of chronic inflammation. Chronic inflammation can be insidious, with symptoms that are often vague and easily overlooked. Common symptoms include fatigue, persistent pain, muscle, joint, or abdominal, depression and anxiety, gastrointestinal issues, such as diarrhea or constipation, weight gain or loss, frequent infections. Diagnosing chronic inflammation. Chronic inflammation is often diagnosed through a combination of medical history, physical examination, and laboratory tests. Key biomarkers of inflammation include C-reactive protein, CRP. Elevated levels indicate inflammation. Erythrocyte sedimentation rate, ESR. A high ESR can signal inflammation. Interleukins and tumor necrosis factor alpha, TNF-alpha. Elevated levels of these cytokines are markers of inflammation. Managing and treating chronic inflammation. Addressing chronic inflammation involves a multifaceted approach, including lifestyle modifications, dietary changes, and medical treatments. Lifestyle changes. Diet. Adopting an anti-inflammatory diet rich in fruits, vegetables, whole grains, And healthy fats, such as those found in fish, nuts, and olive oil, can help reduce inflammation. Avoiding processed foods, sugary beverages, and trans fats is also crucial. Exercise. Regular physical activity helps reduce inflammation and improve overall health. Stress management. Techniques such as meditation, yoga, and deep breathing exercises can help lower stress levels and, consequently, inflammation. Sleep. Ensuring adequate and quality sleep is essential for regulating the immune system and reducing inflammation. Medical treatments. Medications, supplements, biologic therapies, surgery. The role of diet in managing inflammation. Diet plays a crucial role in either exacerbating or alleviating chronic inflammation. Incorporating anti-inflammatory foods while avoiding those that promote inflammation can make a significant difference in overall health. Anti-inflammatory foods. Fruits and vegetables, healthy fats, whole grains, nuts and seeds, spices and herbs, green tea. Foods to avoid. Processed foods, sugary beverages, refined carbohydrates, red and processed meats. Exercise and inflammation. Regular physical activity is one of the most effective ways to combat chronic inflammation. Exercise helps regulate the immune system and reduce the production of inflammatory cytokines. Types of exercise. Aerobic exercise. Activities like walking, running, cycling, and swimming improve cardiovascular health and reduce inflammation. Strength training. Building muscle mass through weightlifting or resistance training helps maintain a healthy metabolism and reduces inflammatory markers. Flexibility and balance exercises. Yoga, Tai Chi, and stretching improve flexibility and stress management, contributing to lower inflammation levels. Stress management. Chronic stress is a significant contributor to inflammation. Managing stress through various techniques can help keep inflammation in check. Techniques for reducing stress. Mindfulness meditation. Practicing mindfulness helps reduce stress and lowers cortisol levels, which can reduce inflammation. Deep breathing exercises. Techniques like diaphragmatic breathing can help calm the nervous system and reduce stress. Yoga and Tai Chi. These practices combine physical movement with mindfulness, promoting relaxation and reducing stress. Adequate sleep. Ensuring 7-9 hours of quality sleep per night is crucial for reducing stress and inflammation. Supplements and natural remedies. Certain supplements and natural remedies can help reduce inflammation when combined with a healthy lifestyle. Popular anti-inflammatory supplements. Omega-3 fatty acids, found in fish oil. These supplements can reduce the production of inflammatory cytokines. Curcumin. The active ingredient in turmeric, curcumin, has strong anti-inflammatory properties. Resveratrol, found in red wine, grapes, and berries. This antioxidant can help reduce inflammation. Vitamin D. Adequate levels of vitamin D are essential for regulating the immune system and reducing inflammation. Probiotics. These beneficial bacteria can help maintain gut health and reduce gastrointestinal inflammation. Medical treatments for chronic inflammation. When lifestyle changes are not enough, medical intervention may be necessary to control chronic inflammation. Common medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, medications like ibuprofen and naproxen, can help reduce inflammation and pain. Corticosteroids. These powerful anti-inflammatory drugs can be used to treat severe inflammation, but are typically used for short periods due to potential side effects. Disease-modifying anti-rheumatic drugs, DMARDs, used primarily for autoimmune conditions. DMARDs can slow the progression of diseases like rheumatoid arthritis. Biologic agents. These targeted therapies can inhibit specific components of the immune response, reducing inflammation in autoimmune diseases. Alternative therapies. Acupuncture. This traditional Chinese medicine technique can help reduce pain and inflammation through the stimulation of specific points on the body. Massage therapy. Regular massages can help reduce muscle tension, improve circulation, and lower stress levels, contributing to reduced inflammation. Chiropractic care. Adjustments and manipulations can help alleviate musculoskeletal pain and inflammation. Chronic inflammation is a silent yet significant contributor to many health issues, ranging from cardiovascular disease and diabetes to cancer and neurodegenerative disorders. By making informed choices about diet, exercise, stress management, and medical care, individuals can effectively combat chronic inflammation. Recognizing the symptoms and taking proactive steps can empower people to lead healthier, more vibrant lives. By making informed lifestyle choices, seeking appropriate medical care, and managing stress, individuals can significantly reduce the risk of chronic inflammation and its associated health issues. Recognizing the symptoms and taking proactive steps can lead to a healthier, more vibrant life.